Karibu tena, tuko katika ile hali ya kumalizia. Tunaweza kumpatia fursa Veronica Muliro aweze tu kutueleza kuhusiana na adhabu ya NHIF. Anahisi vipi kuhusiana na hilo wakati ambapo mtu anashindwa kulipa kwa mwezi mmoja? Veronica.
Thank you so much, Mashurimba. Talking of Kenya as large as a society, women are known to be savers. The little they get, they manufacture it to their families. And basically, I'm going to talk about the penalty that is usually issued to the people. Like, if you fail to pay for 1 month, when you're paying the next month, you cannot be rendered the services until you pay for the month you didn't. But the penalty comes at a half amount. If it's 500, you need to add 250 shillings for your penalty. Now, imagine this girl who is suffering on a rape incident. She doesn't know how to struggle for money. The little she gets, she has to take care of this baby who doesn't have a father. The father ran away. So how will she be able to look for the 500 and still look for the 250 shillings penalty? So I would kindly ask the NHIF to reduce on the penalty and give people the room, since my only word that I'll get it out there is for these young girls. And I'd like the government at large to know the voice of the women is the voice of the nation. Thank you.
Haya, tukiendelea tu, kuna swali lingine la NHIF. Nadhani ni vigumu tu kukwepa masuala ya NHIF kwa sababu wengi wanataka tu kuelewa kuhusiana na swala hili. Jina lako kidogo walinanitatiza. Hebu sema jina lako alafu tueleze swali lako.
Okay, jina langu ni Clean Cute. Naitwa Clean Cute Adisa. Swali langu tu ni venye Bwana Osoro amesema ya kwamba lazima mtu akiwa mgonjwa, either mume au mke, lazima ukue na hiyo marriage certificate. Kwa upande wangu nimeshaachana na huyo mzee, na vile tuliachana yeye akachukua zake na mimi nikachukua zangu. For example, mimi ndio niko na hiyo NHIF card. Sasa for example, bado ni baba ya watoto wangu na bado nampenda. Sasa iwepo yeye akiwa mgonjwa, naweza enda nikamtoa na hiyo NHIF card bila hiyo marriage certificate, ama naweza mwachilia tu kwa sababu hatuko apart because hatuna hiyo marriage certificate. Hivyo tu.
Haya, kuna mwingine hapa na swala kuhusiana na madaktari kwa mpango wa UHC.
Mimi niko na swali.
Anza kwa kutuambia jina lako.
Naitwa Daniel. I have a question. What is the government doing to ensure that it absorbs the unemployed Kenyan doctors? The second question. It's only 2 years ago we saw Isaac Ruto going to South Africa to be repaired his broken nose. Mimi kama mwananchi wa kawaida nakuaje na imani na hospitali zetu za Kenya.
Nadhani hayo maswali yatatufungia hii sehemu ya maswali kutoka hapa kwa wale ambao wameweza kuhudhuria kikao cha leo. Trevor.
All right, asante sana Mashirima, and Osoro will start with you as you give your final comments as well. There have been 2 questions raised to you: the issue of penalty being half the amount of the contribution, whether it can be brought down, and also the NHIF that Cute brought up.
Okay, thank you, Trevor.
Yeah.
I'll start with our assist on the issue of penalties. The provisions of the NHF Act, specifically Section 18 of the NHF Act number 9 of 1998, prescribe penalties for late contributions. For self-employed persons or persons in the informal sector, it provides that if you do not remit in the time and manner prescribed, and when we say time and manner prescribed, is that your contributions for the following month should reach NHF offices before 9th of the following month. And you can remit either through M-Pesa, go through KCB, go through Coop Bank, or go through e-wallet. In event you fail to remit in the time and manner prescribed, it will attract a penalty equivalent to 50% of the money you are to pay. For example, if you are to pay 500 shillings and you fail to remit in the time and manner prescribed, that is before the 9th of the following month, it will attract a penalty of 250 shillings. But going back to the question that our sister raised, that the management considers waiving penalties for self-employed. I'm sure the management is listening, but it's also captured in the statutes. Going ahead, perhaps in future, your concerns will be captured. To my sister, who unfortunately has separated from the husband, we need to consider, because the question you asked, do you continue covering your husband and children? What I like to say, it is for you to make a determination whether you want to continue with your spouse or you've parted ways forever. In event you are divorced, that is, there's no relationship going ahead, you can file an affidavit with NHIF and your husband will be removed from the card. But the dependents, the siblings from the marriage, will continue enjoying the benefit package that is administered to NHIF. Finally, to conclude, the provisions of Section 30 of the NHIF Act empower the board of NHIF in consultation with the Kenya Medical Practitioners Board, pursuant to Cap 253, to empanel facilities. Now, recently NHIF rolled contracts for facilities for a period of 3 years. That is the period 2018 to 2021. The provisions of the newly rolled contract, Section 2.23, talks about detention of patients in healthcare facilities. Section 2.2.1 expressly states that the healthcare facilities acknowledges the Constitution and guarantees every person to the right of freedom and right of dignity. It goes further ahead to state that without prejudice to the provisions of the clauses above, treatment of patients except medical conditions, people ailing from psychotic conditions, under the Medical Act can be detained, but any other persons should not be detained in any healthcare facility that is empaneled by NHIF. In a nutshell, in event you are detained in any healthcare facility, and for that matter we've empaneled 8,000 facilities, you can petition the fund and will take remedial measures to address those issues. I kindly beg to rest.
So basically no one should be detained, that's what you're saying. As long
Yes,
as you're
Trevor.
covered under NHIF, you should not be detained in hospital.
Yes, Trevor.
All right.
It will be a violation of the contract that you signed up to.
Okay. Angela, final thoughts on this?
I think, thank you, Trevor. And I think what I can say is that we, as a country, everybody has a role to play. The citizens have a role to play. And one of the things, I'm happy that he's talking about what is really coming up. It is us, the Kenyans, to really go ahead and really find out what is in need for them. For example, a good example is a constitution, and I will start with that. Read for yourself, understand what does it mean for you. Let it be elaborated by other people and the like for you to be able to understand, and anything else that concerns you, because health and healthcare is our responsibility as citizens. So we cannot really say it's only the government and we'll just be pushing the blame to the government. Even us, we have a right and we have our own entitlements that we should push for. On the side of the rest of the stakeholders, the government and other entities concerned, I think it's important that when we talk about rights and responsibilities, let's stick to that. Let's put in place measures and let's walk that talk. Let's not say we will do this and then we walk the talk and halfway we stop, or we do not really walk it walk the full length of the talk. Yeah. So I think it's a balance between the consumer and the provider of the service. Let everybody who has a role to play, and not just the public sector, but also the private sector, as Mheshimiwa was talking about, because you are providing services to citizens. They are the consumers. At the end of the day, you run that business because of them. So let's ensure that at least there's an amicable way of ensuring that all of us benefit, because at the end of the day, we are Kenyans and we need to enjoy our health and healthcare in the right way. All so right. I think it's all of us to be able to understand what that means and what are my implications and responsibilities as citizens and as duty bearers.
All right.
Yeah.
Dr. Kioko, final thoughts.
Yeah, thank you very much. I just will say that one, maybe to respond to the question of the doctors who are unemployed, the plans are underway to make sure that these young doctors who have qualified are actually employed. But again, also to say that of course we know that the cost of healthcare in this country has been increasing over years, and what we note is that the pricing of services, which has a very huge disparity across facilities. You will find that maybe a cesarean section in Nairobi Hospital costs different from what is in Mata or what is in Aga Khan. And what we are doing as a government through the ministry is to now we've embarked on the process of harmonizing and standardizing the cost of health services across the facilities, including even the health products, the medicines. Because one of the things that makes healthcare unaffordable in this country is the cost of medicines. So we have embarked on this process that will make sure that the cost of medicines also becomes very affordable and overall health care. But again, I also want to say that I think Kenyans, we need also to be responsible. We need to stand to be counted because you are responsible for your own health. Okay. And it's high time. Sometimes because of the cost of health care, Kenyans actually now come up with coping mechanisms. And coping mechanisms is either you delay going to the facility, or alternatively you just ignore it altogether, or you are able to seek alternative care either with traditional healers or the herbalist or things like that. Okay. But this is not good. And therefore, as a government through the ministry, our commitment is to ensure that Kenyans remain healthy. That is our commitment. They remain healthy and they are free of diseases. All right. Through the universal health coverage, our now approach is to make sure that Kenyans now become responsible for their own health, so that we invest on high impact health promotion and disease prevention interventions that Kenyans, because these are low cost, that Kenyans can be able to adopt. All right. I usually get worried, and no wonder the high burden of non-communicable diseases is getting high in this country. Because how many people actually jump into their cars? The next point you are getting is next to your office. Yeah. Then you are seated in the evening, you jump back to your car and go back home. Okay. No wonder then the incidences of hypertension and diabetes and heart diseases are actually very. I want to ask Kenyans to start walking, going to work. Start walking. Okay, now that's a whole different conversation. Dr. Swarup, final thoughts on that?
Thank you very much. Yeah. Before I give my final touch, I'll tell you, as Parliamentary Health Committee, as your servant, we have already reduced 20% from doctors' fees. I think Ministry will tell us. Number two, we are on the way to reduce the cost of medicine and the devices very soon. And then equating all hospitals, the prices that will also ensue. Okay. But before that, I'll tell you also the final thought, please focus on preventive aspect of health. How to prevent disease. That is the best way to reduce the burden all of us. The final toss is that the patient right is the health right first. First right of health right is the patient right. We have to get best diagnosis, right diagnosis, best management, best therapy treatment. Number three, with human touch. And this is our country. Nobody should detain us. Number three is that if we detain a healthy man after making treatment, then we are making that person in jail. Okay. So please, nobody, I'll start right now from my hospital. I'll see nobody will detain right now. All right. They will be gone. And also, there is a right to the hospitals that we should not forget. Somebody has given us a glass of water, we should say thanks. All right. Thank you very much.
All right, thank you. That's a good place to leave it. Dr. Swarup Mishra, MPKSS and Vice Chair, Health Committee in the National Assembly. And we also have Dr. Jackson Kioko, Director of Medical Services, and Angela Nguku, Executive Director, White Ribbon Alliance, and Gilbert Osoro, Manager, Benefits and Contracting, NHIF. Special thanks to the Park Inn by Radisson, the scenic place for just hosting us this evening. That does it for me. My name is Trevor Mbij. Always a pleasure having you with us, and always a pleasure having the audience as well. Brilliant performance from them and many questions coming through. Mashirima na bado kuna maoni pale, sio?
Ningependa sana kuendelea na maoni, maana yake yako mengi, na bila shaka Citizen Town Hall haiwezi kuwa kamili bila wale ambao wanajitolea kufika hapo ili kuuliza maswali, pia kuweza kuelewa tu mambo kadha wa kadha. Hadi Jumatatu ijayo, na kutakia usiku mwema.